Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units whilst providing quality care for long-term ventilated adults and children with tracheostomies. Otherwise medically complex adults and children at home, including home TPN, home BIPAP, home CPAP, also home tracheostomy care for adults and children that are not ventilated. We are also providing IV potassium infusions, IV magnesium infusions at home, IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, as well as palliative care services at home. Now, in today's blog post, I want to celebrate and announce that Intensive Care at Home is now accredited for the Australian Community Industry Certification Scheme, ACIS 4.0. This accreditation scheme enables us to provide nursing care for ICARE New South Wales at the highest levels as part of the insurance scheme. We are the specialized and leading intensive care at home nursing service, sending critical care nurses into the home for, like I said, mechanical ventilation, tracheostomy care, BIPAP, CPAP, home TPN, home IV potassium, magnesium, home IV antibiotics, port management, PICC line management, central line management, Hickman's line management, as well as palliative care. So not, as far as I'm aware, in 2024, in Australia, there's no other service provider that has actually achieved third-party accreditation for intensive care at home nursing, right? We have built unique intellectual property, unique policies and procedures. We are employing hundreds of years of intensive care nursing experience that we are combined, that we are bringing into the community that is unmatched in the community. There's no other service that brings the area of expertise and the area of skill into the community than we do, enabling long-term intensive care patients to improve their quality of life, and in some instances, quality of end of life at home. This is underpinned by us also providing an emergency department bypass service for the Western Sydney local area health district, where we are sending our critical care nurses into the home to avoid ED, emergency department admissions and emergency department presentations, again, taking the pressure off hospitals. And like I said, we're all about quality here. You know, look at other services that claim they can do tracheostomy, ventilation care at home. They have no accreditation, right? They don't work as per evidence-based practice guidelines like we do. When you have a look at our mechanical home ventilation guidelines on our website at intensivecareathome.com, you will find that the guidelines that we're working under are internationally recognized and are a result of over 25 years of intensive care at home nursing in Germany, as well as over 10 years of intensive care at home nursing in Australia. Only critical care nurses with a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care qualification, can provide services for the patients that I just talked about: long-term ventilation, tracheostomy, tracheostomy without ventilation, BIPAP, CPAP, and so forth. It's evidence-based, and we have the accreditation and the intellectual property for it. And our services are evidence-based and safe. We're bringing quality in the community. Many other services cannot bring the same level of quality into the community. Once again, we are employing hundreds of years of intensive care and emergency department experience combined into the community with our nursing team, and that is unmatched in 2024 in Australia. Now, we're also providing level 2 and level 3 NDIS support coordination. We are currently operating all around Australia, in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider all around Australia. Obviously, we are ICARE approved in New South Wales. We are also a TAC approved service provider in Victoria and NIISQ approved service provider in Queensland. We are also a DVA approved service provider all around Australia. DVA is the Department of Veteran Affairs. We have also received funding through public hospitals, departments of health, as well as through private health funds. So reach out to us if you need help at intensivecareathome.com, call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecareathome.com. As part of our Level 2 and Level 3 NDIS support coordination, we're also providing specialist NDIS nursing assessments if you need help with that. And if you're an NDIS support coordinator and you need nursing care for your participants, please reach out to us as well. Or even if you don't know how to go about nursing care for your NDIS participant, as part of clinical governance, providing evidence, but also as part of choice and control, please reach out to us. We can help you with that and walk you through the process. The NDIS in Australia is funding nursing care. It just needs to go through the right advocacy process, which we are the experts in. So please reach out. And if you have a loved one in intensive care, or you are in intensive care yourself and you're watching this or reading this, and you are stuck there long term because you are ventilated, you have a tracheostomy, I encourage you to reach out to us as well. Once again, we can help you go home and get you out of a depressing intensive care environment. Or if you're at home already and you have insufficient support with the conditions that I mentioned, then I also encourage you to reach out to us. We can help you stopping your hospital readmissions. We can help you filling the shifts that need to be filled. We have seen many clients, and we work with many clients now that had insufficient support at home, insufficient funding. They didn't have the providers engaged that knew how to go about filling shifts, that didn't know how to get the funding. And that's what we are the experts in. So please reach out to us. And if you are a critical care nurse and you're looking for a career change, we want to hear from you as well. If you have worked for a minimum of 2 years in critical care, ICU or ED or pediatric ICU, and if you ideally have completed a postgraduate critical care qualification, we currently have jobs in Sydney, Melbourne, Brisbane, in Albury, Wodonga on the New South Wales-Victorian border, in Bendigo, in Country Victoria, as well as in Warragul in Country Victoria. We want to hear from you, and we're looking for people that want to complement our team, that are team players, and that are looking for regular work with our vulnerable clients. Please keep in mind that we are a service provider with a tailor-made solution for our clients. We are not an agency. We pride ourselves on providing tailor-made solutions for our clients. So if you're looking for agency work and you want to come and go, drop off, drop in, please don't come to us. This is not the right place. Only apply if you want to make a difference to our clients' life. If you want regular work and if you want to make a difference to our clients and their families' lives, that includes working with our clients on a regular basis, not come and go. You must be reliable. Don't apply for us if you're not reliable. And if you're an intensive care specialist, we're currently also expanding our medical team. And if you're please reach out to us if you're interested in working with us. And if you're an intensive care specialist and you have bed blocks in your ICU, which I know you do, then I encourage you to reach out to us as well. We can help you eliminate your bed blocks in ICU, ED, and in other high acuity areas by taking your patients home, which includes palliative care for some patients. And if you're a hospital executive watching this, we also want to hear from you because, once again, I know you've got bed blocks in your hospital, in your ICU, in your ED. We can help you eliminate all of that, and you don't even pay for it. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share the video with your friends and families, share it far and wide, and comment below what you want to see next, what questions and insights you have from this video. Reach out to us at intensivecareathome.com, call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. Thanks for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.